Rambihar.
It's a pleasure to be here again and to be back in New York and to meet all of you. Last year, I suggested that GOPIO move away from their traditional mandate of the usual issues that Ashok told you about earlier and to engage in health. So this has happened today, and this makes a very historic occasion due to the hard work of everyone in GOPIO, Sangeeta, the executive, and everyone else, and many of you here. Since myself and Dr. Binoy Singh is what's left separating you from dinner, I'm going to cut most of my remarks here and just raise just one or 2 points. The question is, why did GOPIO do this? And more important, what happens next? We're not here to listen to lectures. We will listen to lectures, but that's not why we're here. Nobody should sleep in tomorrow. We have to listen to Dr. Enos. He has done more work than anyone else to elucidate why we have these problems. And then we have lots of other people telling us about health concerns of people of Indian origin globally. We're talking about 1.3 billion people, 25 million across the diaspora. So that's why we have a summit. Not to just talk and listen to lectures. The reason for a summit is to rethink everything, to try and understand what's happening and find new ideas and fresh perspectives. And more important, to make change that really happens. Not change that we believe in, but change that must really happen. So just a couple of points. Think of your personal health, community health, and global health like the economy. It is simple and it is complex. It is web-like and it depends on everything else. So whatever you do will make a difference. Find a global approach. We have to look at the socioeconomic, education, poverty levels across this entire diaspora and adapt to local situations because of tremendous differences. We're not here just to talk about New York or New Jersey. We are here as GOPIO to look at the health issues facing the Indian diaspora everywhere. We have to look at what's called adaptive action. We don't just set up things that we do and stop and wait 5 years to evaluate it. We need to change as we go along and see how we're doing at all levels, personal, policy, grassroots collaboration, because whatever you do here travels across time and space and changes everything. Then we should use our rich traditions for networks for change. There's a Dr. Christakis at Harvard who says that your friends' friends influence your health. Let us learn about these things. These are new ideas. And that's why networking like this, whatever you do here, impacts on people far away. So it matters. And the last thing I would say is we have to commit to change. The Clinton Global Challenge, you are not allowed to go there unless you commit to change. So at this GOPIO summit, you are not going to be allowed to leave unless you have a commitment to change. Decide what you're going to do and change and start that change. Now the question is, can we do this? And with the much vaunted Indian success in everything else, to quote your president, yes we can. You change something today, and that way you save the diaspora and you save the entire world. There's a global crisis and economic crisis that are related. It is your opportunity to change starting today. So those are my opening comments and remarks. And this leads us on to the guest speaker for this evening, Dr. Binoy Singh. Now where are you? I did not get to see you. Here, there you are. Welcome to GOPIO and this evening summit. I'm not going to read his entire resume here, since again, he and I are all that separates you from dinner. Dr. Binoy Singh is a cardiologist and assistant professor of medicine at Columbia, currently serving as director of clinical business development for Columbia University College of Physicians and Surgeons, and he can tell you more what this entails and how it entails getting into the community, which is what we need to do. He completed undergrad studies in biomedical engineering from Boston University, medicine at Drexel University, cardiology training in Columbia, and board certified in internal medicine cardiology. His experience and insights in cardiology and his outreach in the community are going to be very valuable, and we can learn from this and how to apply this for what GOPIO plans.